Hi guys, it's Beth, and I'm back with a technique video for you guys. And we're going to talk a little bit about low back pain. And when you've got a client who's got low back pain, a lot of times the low back pain is not really originating in the low back. So we're going to spend a little time just kind of warming up the low back. But then I want you to kind of look into a couple of different areas that may be causing low back pain. Number one, we're going to work a bit on glutes, and I want you to pay a little bit of attention to these erectors that run from the low back all the way up to the cervical spine. And those are deep, so we're going to do a little warming, effleurage strokes, maybe some cross fiber to warm the tissue up before we get in here. And then I want you to concentrate some on the glutes. Now, glutes are kind of fun to work with because they're nice and thick, and so you can do a lot. But what I want you to be aware of is the client's iliac crest, the client's sacrum, and the client's greater trochanter. If you can kind of draw a line between all of that, any of that space in between is where you can give some good pressure. You can make some movements and get some of that tissue loosened up. Now, like I said, you can do this over the linens, or certainly you can do draping differently, however you're comfortable. Probably something you want to discuss with your clients before you start working with them. So today we're going to work just over the linens, and we're going to not use our flat hand a whole lot. I like to use a fist, or I'll come in with my forearm. And I tend to roll from the trochanter back towards the sacrum first and see if I catch any areas where there's tension. He's got more tension near his sacrum. He's fighting me just a little bit as I do this. So I'm gonna then kind of come in here and work for just a minute. And the first thing I'm gonna do is just hold. I'm gonna sit on that tension, and I'm going to check in, and I'm going to say, is this easing or is this increasing your tension?
Easing.
It's easing. So as it eases, I'm going to just stay here for a little bit longer. You can sit on a tension spot for up to 2 minutes. That's a really long time for me. I'm a little ADHD, and 2 minutes is a really long time. But you a lot of times will feel that you can sort of get a little bit deeper in as you're sitting here. And that's what you want to go for. So once it starts easing, you can adjust. And I always like to say, once you do something mean, something deeper, then you want to come back and do something a little bit nice. So a little bit of effleurage, a little bit of circular friction, just to get the blood flow back into that space. And then finally, when we're done with whatever we're doing, I'm going to do a little bit of a flush of the area. So in this case, I'm going to flush all the way back up towards the cervical spine before I finish and move on to the next side or the next space that I'm going to work on. So I hope you found this helpful. I hope you have a great day, and I'll talk to you soon.